Welcome back, everybody, to the Blueberry Pediatrics Podcast. I'm joined today by Alice Lee, who is CEO and founder of First Day. First Day is a wellness brand for modern families that is digging out dated science in the space and taking a fresh approach to tackling hidden health crises so families can live healthier lives. Prior to this, Alice was Senior Associate Consultant at Bain & Company. She's also been a research assistant at Yale, an analyst at Veritas Investments, and holds a BA from Yale University. Alice, thank you so much for joining me today.
Thank you so much, Lyndsey. It's a pleasure to be here.
So as I'm learning about First Day, I'm always curious, especially as another founder, what brought you to the space and what made you interested in starting a company like this?
I think it's a very intimate story for me in particular. I'm Chinese American. I was born in China, but I grew up in California, which was a wonderful place to grow up. Farmers markets, organic produce, the land of abundance in so many ways. But when I actually, talked to my broader family or even my parents about their background, it was so different. So my grandparents lived through the Great Chinese Famine in the 1950s. It's the largest famine in human history. Even in my parents' generation, it was so hard to even get meat to eat. And that honestly would only happen typically once a year during Chinese New Year's. And as I've seen my broader family age, my parents, you can really tell that even though in the last few decades, China hasn't been like that. And, my parents have immigrated to the US. When your body misses something incredibly critical at a really important time, it's hard for it to make it up. And you see changes in chronic illness, quality of life, and all of these things that become so important in life and with your family. And so that really inspired me to honestly try and do something about it. And the more I looked into what was happening in the space, whether supplements, nutrition, medicine, there were so many gaps that were leaving just modern challenges that families are facing completely uncovered. And so that's really how First Day got its start.
Yeah, I mean, it's such a deep, insightful perspective to have, and then to turn it into your life mission is just so impressive. So how does this translate then into what you've brought, the space that you've brought these ideas and your dreams into?
Such a great question. I think in two big ways. One is in our company mission. So our mission is to help 1 billion people become healthier, whether it's through our products, our team, sponsoring clinical studies, which I hope to do in the next few years, or more, in education. I think that's one aspect of it that really pervades everything that the company does and what we stand for as a brand. The second piece of it is really our philosophy behind our products. So what we see in supplements in particular is that most brands are just putting things on shelves that consumers are willing to buy. It's just there for sales, it's there for revenue. There's almost this lowest common denominator of, consumers don't really understand the science or the medicine or the health. And we know they'll buy these things even if they don't work. And so we're willing to sell it. And that as a starting point was frankly just unacceptable to me in how I thought about what we create and how we do it. And so every single one of our product lines is oriented around a hidden health crises. So for our multivitamin line, we're really focused on vanishing nutrients and hidden hunger. So up to 87% of fresh fruits and vegetables today have actually lost their nutrition compared to 50 years ago. And that's because of monocrops, factory farming, GMOs, soil depletion, even to some extent global warming and how that's changed how agriculture grows and builds and how all of that works. Our Tribiotic line is oriented around breaking down microplastics. The average American consumes a credit card's worth of microplastics every single week. It impacts your endocrine system. It crosses the blood-brain barrier. It infiltrates your gut. And there's a lot that we don't understand about these changes that, frankly, humanity has created in the world, sometimes for better and sometimes in these ways that we don't fully understand. And because we take such a different approach, it means that we're actually able to not just put out a product for the sake of doing that, which we would never do, but to really resolve what we see as the root cause that may be impacting how someone feels, right? Magnesium is a good example of that as well. The reason why we produce a calm and sleep line focused around both fulfilling magnesium deficiencies as well as providing some form of immediate relief. We have clinically backed ingredients in there that actually create impact, sometimes within hours, is with the American diet being 70% full of artificial additives, highly processed foods. That's actually fundamentally interfering with our own absorption of critical minerals like magnesium in our day-to-day, even if we consume it. And that's leading to things like people feeling exhausted, can't stay asleep, high levels of stress, which also map really well to how a lot of people are feeling every day and what they're struggling with.
Gotcha. Okay, so you talk about a lot of specific vitamins, minerals so I do take a perspective of a pediatrician, and I know a lot in our field is certainly missing about this in terms of hard research, and we do take a lot and extrapolate from adult literature. Is there the things that you're bringing up about like magnesium? Have you found studies? And I know you work with some researchers. You can tell me more about that, but are there studies that you usually quote to show that there's this deficiency, and then that the supplements are helping with that, and then taking it to the next level, that not only with the supplements is that level, let's say, of magnesium, is it being replenished by supplements, and then is it helping is it changing any type of outcome like calmness or sleepiness?
Yes, that's such a great question. And I think that philosophy of clinical efficacy is tied into every choice that we make on the product side and what we stand for as a brand. So when you look at the studies out there, there's actually already been tens of thousands of studies that are relevant on a pediatric population, in addition to the other end users that our products cover, which are, we have toddlers, kids, teens, men's and women's, and we'll expand that out to other periods of someone's life as well. And what we're seeing happening is that all of that research actually already exists within the field, within what the top researchers are looking at. And I think what you're referring to is we have an incredible scientific advisory board of professors from Harvard and Yale who are specialists. And it's about how do you bring that to commercialization and to access to a population that doesn't necessarily fully understand the research. They don't have the education to do it, and frankly, they shouldn't be expected to do it because they're living their lives and they're making all the choices they need to in their daily life that's really critical to them. That doesn't involve actually, understanding, as an example, what form of vitamin A is actually safest for their body and won't cause risk of overdose, won't cause higher risk of cancer, which actually a double-blind clinical on vitamin D oversupplementation actually showed. And so the way we go about our formulation is every single product is created by looking at actually thousands of studies that are relevant, whether on an ingredient level, on the relevant population size, the chemical form, how those actually micronutrients interact with each other biosynergistically in addition to standalone, and making sure that we feel really confident about the way that those studies were conducted, that they're double blind, that they're gold standard, that they're things that we can stand behind. And so all of that goes into how we look at that initial scientific formulation, in addition to thinking about actually, I think the Hippocratic Oath, which obviously doctors really abide by, and thinking through what is the potential harm of oversupplementation, for the variances in the population of some people get enough, some people might not, and how do we balance the benefit, and how do we actually formulate so that that is safe, efficacious, and providing more benefit than harm. And after that formulation process, we go through a really rigorous manufacturing process as well in supply chain, where there's testing at multiple points in the chain. After production, we're testing for both purity, efficacy, concentration, and all those things that make sure that we feel really confident as a company that consumers and families can trust us, can trust that what is supposed to be in there is actually in there.
Okay, gotcha. So, when we do tests on kids, like blood tests, when we do them at, let's say, like the 1-year exam, 5-year exam, we aren't testing vitamin levels necessarily. Maybe
Yes.
Vitamin D, but not even.
Yeah.
So isn't it like, to me, it sounds like, how do I know that these kids are suffering from any deficiency and that replenishing it will change anything? Or, like, do they even need it?
It's a great question. I think there's been a couple of really incredible sources at an international and also US level that show that to be the case. So globally, there's a number of organizations, including the WHO, who has identified hidden hunger as a critical challenge that they are tackling, both in terms of active malnutrition and also just simply undernourishment. So something that's not necessarily obvious, where someone is getting enough calories, but where there are these underlying deficiencies, but it's not severe enough for something like scurvy or rickets, which are primarily, luckily enough today, things of the past for the most part. There's still incidences, but obviously in a place like the US, the incidence is very, very low. But when, for example, the NIH and other government entities in the US have done survey level data and tracking at a population level for the US, they've identified that actually 93 to 97% of both kids and adults are missing in at least one micronutrient, and that it is at some level impacting their health based on what we understand about the chemical pathways that these nutrients actually carry upon, right? They're coenzymes, they interact with cellular development, they impact how our organs function. And for most people, it doesn't rise to the level of where you're seeing severe symptoms, which is really good because we've solved, for the most part, really severe issues around not having enough food for most of the population in the US. But for a lot of people, it's simply just so hard to eat healthy every day. Like, just speaking for myself, I know that when I don't eat well, I can feel it, even though I can't pinpoint it. And that is shown statistically in a lot of this research I'm referring to as well. And so, through what we understand about how these ingredients actually are absorbed in the body, a core part of our philosophy is we're choosing ones that are the most absorbable, but also create the least harm. So I can give a couple examples. We actually choose not to include calcium, even though it is a common deficiency in the population, because it's been tied really closely to a couple things. When you actually track that supplementation within populations, like Harvard has a large study on this, you find that a lot of calcium supplementation is, to your point, actually not being absorbed correctly because it's not the right form, or alternatively, people are over supplementing and it's actually leading to heart disease. So arterial calcification and other negative health effects. And so because of that, we actually looked at, okay, what are people consuming and what is the real cause of that deficiency? And we were seeing that a lot of people consume calcium also because it's heavily enriched, right? It's in milk, it's in a lot of different products, orange juice, cereals, all of these things that people are consuming every day. But one of the challenges is a lot of people aren't getting enough vitamin D to absorb it because it's a coenzyme. And so that's why we choose to have the level of vitamin D that we do. And another example, in case it helps, is actually vitamin A, which I referred to, at the beginning of our conversation. But there's a lot of different forms of these chemical compounds, and there's a lot of trade-offs. So vitamin A is fat soluble, which I know I'm preaching to the choir, but for the broader audience out there, it means that it's actually stored in fat within the body. And what that means is it's harder for your body to regulate the level of absorption. And so it's easier to consume too much and it's easier to overdose. And having too much vitamin A in the system is actually just as dangerous as not having enough. And that's been shown in a study coming out of the Nordic countries where they actually did a double-blind clinical on how supplementation of vitamin A changes incidence of cancer. And the dose that they were testing was so high that they actually had to pause the study midway through because they found that cancer rates were actually elevated from overconsumption. And so there are dangers to taking too much of these, minerals and vitamins. And that's why I think looking at it from the flip side is just as important, and why we also use beta carotene, which is a compounded version of vitamin A that your body can actually choose whether or not it converts into something that's active, right? If you're already getting enough through food, which the vast majority of people are, to your point as a doctor, like most people try to eat well, but there's a significant portion of the population that doesn't get it. And then you can leave that to the body as a choice to, okay, if you're already getting enough, you can pass through beta carotene pretty safely. It's the same form that's in carrots. And it's also a form that's more expensive, that's harder to work with, which is why most brands never use it. But if your body does need it, then it's available and it can help fill that gap in.
Okay, great. That's so much information and it brings up so many questions in my mind. So,
Yeah.
So parents are going to be giving these without really, a lot of times consulting their pediatrician because like it's on the shelves, it's for consumer
Yes.
usage, it's online available to everybody. So how do we know? It's hard for me to reconcile like supplementation, trying to keep healthy, no doctor involvement, but like doctors might not be pushing these things because when it comes to supplements, like FDA regulation is an issue. You don't know.
Yes,
of
course.
We don't always know what they're getting compared to what a bottle says. So
Yes.
How do you reconcile that part of it?
Yeah, I completely agree with you. I think there's a challenge within the industry where we have basically the estimates range from 10 to $20 billion industry in supplements within the US that doesn't have a lot of oversight. There are some regulatory guidelines that have protected consumers, but it is not at all close to what else exists in other parts of industry or medicine. And I think that is actually why these sorts of conversations between incredible brands like Blueberry and brands like us who are trying to elevate standards in the industry are so critical, because education of the right professionals, the right people in places of authority, so that they can then share that with their patients as needed, so that we can also integrate that into the marketing that we do, is just so incredibly powerful. And I also think it's why the brand matters so much, because when government oversight in a category is weaker, then it really falls onto the companies to sort of self-regulate, which is obviously very challenging for many reasons, but it's also why someone like me started the company that I did, so that we can actually change things for the better and show families that they don't have to compromise and they don't ideally have to worry about things like you're talking about, where you're buying something and it fundamentally just doesn't include what it even is supposed to. And a side note on this, I actually recently heard about one of the top Amazon brands in actually the protein space, and they had released a protein-oriented gummy, and all testing had actually shown that what was supposed to be in there wasn't even logically possible. Like the weight of the gummy was actually too low to even contain what the supplement facts was claiming. And so you're right, there are a lot of bad actors out there, and why I think it's really critical for startups like both of ours to really make sure that we're doing the right thing by consumers.
Okay, gotcha. So then the other question that comes to mind is that the products that you sell are, I would say, a little more pricey. You could tell me I'm wrong, but they are, understandably so, all of this rigorous testing and ensuring that you have like the right ingredients and that you have the staff and the researchers on board and the research that you've done already to create it. Like it makes sense to me that it's going to be a higher priced item. So then I think what the question in my head is that the discrepancy between the population that might be buying it and can afford it, are those the ones who are going to have the deficiencies? Because I can understand when people are not able to afford the ingredients or have the education to know which ingredients they should be pushing on their kids every day. Is this, the population that can afford it, is that who needs it the most? I'm assuming no, but I don't know how to like bring those two together.
Yes, it's such an insightful question, and it's one that I've thought about a lot, because to your point, a lot of the research shows that users of supplements tend to be higher income. They tend to be higher education attainment, and that tends to lead you to a population where deficiencies are less of an issue in general. I think there's a couple ways in which we try to tackle this. One is social impact is a big part of what we do. We've donated, I think almost $2 million of product to at-risk populations.
Wow.
That's something that's really core to what's important to me, having the family history that I do. And one way that I also think about the brand is, I have a lot of friends who are really dedicated to social impact and who have even founded nonprofits. And one thing that's really challenging for them is actually funding. There's this incredibly difficult nonprofit funding cycle for both actually groups trying to do good, also on the science side as well, which I know you're only too familiar with. And if you can actually structure a brand that is trying to do good through the product, that is highly profitable, and that also wants to do good in the world, you fundamentally actually able to redirect resources in a really effective way because this is so challenging for nonprofits. So that's one aspect of it. The second aspect of it is it's a big focus of us to educate. So what we see is that there's a really large gap in why people are taking supplements, and it purely just comes from, it's actually rooted in a lot of the questions you just asked. It's so complicated. There's a lot of fads and misinformation out there because of both the complexity of what we are facing as a society and also media, right? Like media loves bite-sized things. They love things like, matcha is the newest fat burner. And if you take matcha, you're going to lose 15 pounds in a week. And those things fundamentally aren't conscionable, right? Like a doctor cannot endorse that. And a brand like us cannot use those sorts of claims or ingredients because we fundamentally don't believe in them. And what we've seen is because we focus so much on education through our brand, through our marketing, through our site, through even what appears on our products, it's actually really helped even the gap out. So as a direct-to-consumer business, we have a lot of data on our consumer base and how it maps to the US population. And even with our price point, what we see is there's just this incredible need for better solutions for health for families. And even at our price point, which is, to your point, because of the rigor, the ingredient quality, the way we go about sourcing, the way that we're not willing to compromise, we actually still see that our customers pretty much map to the US population, like in terms of income, geography, rural, urban, suburban. And that was honestly something that was really surprising to me when I started to look into it. But I think it's just an incredible stat about the resonance we've been able to build in the market because of our approach and because people are genuinely feeling like they're seeing results, right? If you're taking a gummy vitamin that's, let's say $30 a bottle and you're not seeing results, you're just going to tell yourself, well, this was expensive candy, right? Like I can't keep this in my budget. But if you're taking it and you're observing, oh wow, like I don't know why, but I really do feel a little better. Or actually certain things are a little easier, or I can fall asleep better, or, it's really helping me in this way, then that's when you can actually create value for people.
Great. That's really wonderful.
Yeah.
I didn't know all about the nonprofit world that you are involved in as well, and the donations. That's incredible.
Thank you. That's so kind of you. Yeah, it's something that matters a lot to me, given, just where I came from. And I feel like so many people don't have the luck to have grown up the way that I did. And I wish that we all could have that, have more than enough and everything that we need.
Yeah. So you spoke about education. I'd love to get into that because I think it's really at the crux of like what we're both doing here and trying to educate parents on making the best choices for their children. When it comes to nutrients and food and the U.S. food supply, what are you trying to put out there in your social campaigns or even in your advertisements, and then trying to teach people on how to live a healthier life, especially for their kids?
Yeah, I think something that was really shocking to me was when I learned that a third of cancers are actually caused by nutrition and lifestyle. And, I already talked about vitamin A, but there is so much that I didn't understand was actually under my control to some extent. Cancer is actually a crazy example because it's scary. It's something that's now happening to a lot of people. We don't fully understand it from a scientific or medical point of view, although that's like growing by leaps and bounds, which is incredible. But a lot of what is leading to these things that really impact our lives are actually built into the day-to-day. It's built into, are we exercising in a way that actually helps build like lower inflammation and helps keep a level of fitness that's going to allow us to age well. It's built into, okay, like what's the percentage of our diet that's highly processed versus is like whole foods and foods that we think are highly nutritious because of the source. And a big part of what we focused on is just helping families understand that connection, because we all know we should eat healthier. Like I don't think there's a single person I've talked to who isn't like, oh yeah, I wish I ate more vegetables, or I wish I just really like salads. And honestly, for myself, I don't like salads either. So it's also a very personal journey that I struggle with. But there's a fundamental connection between, hey, I did not, and I'll just speak for myself, as a person, I did not eat well today because I had junk food, or I had takeout, or I didn't make the time to go for a walk or go for a run, and now I don't feel well. And actually, there's such a close feedback loop there. And I think even helping people understand that cause and effect and what things they may be feeling in their daily life, whether it's, oh man, I'm just so exhausted, I can't focus, or actually I can fall asleep, but it's so hard for me to stay asleep, like I keep waking up, or my kid sort of goes from extreme to extreme, like they're bouncing off the walls, but then they seem totally out of it. And I don't know why. Like I've tried a million things. Nutrition can just be another thing that's like a tool in your toolkit to look at of, hey, like I tried different parenting techniques. I tried going to the doctor, to your point, or I tried speaking with their teacher, or, I tried to instill these habits with them and they're still struggling. Okay, here's another thing that could be a hidden cause. And it's just something that's worth looking at, right? And I think a lot of parents, they have so much pressure. There's so much messaging around, oh, you have to do X, Y, and Z, and you should feel a lot of guilt if you're not the best parent in the world. And I think there's so much value in just giving them a little bit of support and telling them, like, it's okay, you're trying your best. It's not you. Like, there's these things that are happening that may be out of your control. And here's like, 1 out of 10 things that you can just look at and see if that helps your family or yourself or your child. And it's also okay if you're finding that really hard, because we all are. And I think I don't know if I explained that perfectly well, but that's something that I think is really important to me.
Yeah, that does make sense to me. And I think knowing what it's like to try and grow a company and stay true to your virtues and your overall mission can be tough in business. So how do you stay focused on your mission without making concessions and compromises, and when there's competition coming and it can get tough. How do you deal with that?
The one thing that I never underestimate is parents are so smart and they really just want the best for their families. And I think there's a lot of companies out there that think that they can trick consumers, that like they can, quote, get away with things. And what I've seen is if you really make an incredible product, if you really, as a business, care about the integrity of what you're producing and how you're doing it, the market will actually adjust. If you have good product market fit, they will recognize that you are an incredible solution to whatever problem that you're trying to solve. And something that I personally have a deep belief in is I don't want to have to compromise my personal values in order to run a really successful brand and company that can achieve our mission, that can do some good in the world, because capital is also a potential force for good. And I think there are examples of brands like Patagonia and a couple other ones where they've been able to effectively merge, okay, here is what shareholders need in terms of profitability, in terms of discipline, and make sure that they run their company with a level of effectiveness, rigor. All of those incredible management principles are important to helping a business survive in a very competitive world now, and wanting to produce things that are really best in class, that work really well, because those things actually lead to consumers coming back and loving the brand, which also drives up profitability. And so that's the way I prefer to operate.
Very nice. All right. I want to make sure I hit one pressing question that I spoke to another parent. I actually got this, the vitamins and supplement from First Day. My kids loved it. I tried it. I think it's pretty good too.
I'm so happy.
Yeah. So how do you make, or let's talk about the sugar, because like I think what a lot of parents have problems with is that it's a gummy.
Yes.
Truthfully, I'm a pediatrician and a parent. Like I know the challenges of like, got to get it in. Somehow it's like how we put all this nonsense and grossness into like their antibiotics when they need it, so that they'll take it because they have to take it, and it's the lesser evil of them not taking it to get better.
Yes.
So, like, can you talk about the sugar and like how you deal with that?
Yes. I think that is an incredible perspective as a doctor yourself, and I completely agree. You know, you can produce the best product in the world, but what every doctor struggles with is patient compliance. Right? You can like prescribe them incredible medication, you can prescribe them the best lifestyle, and if they struggle with it, it just won't matter how good the solution is if they can't implement it. And so that's a big part of how we think about, okay, we want to use clinically backed ingredients that are highly efficacious, but it has to be habit building. It has to be something that works really well with all the different things that a parent is trying to juggle in the morning, at night. So I completely agree. You know, the way we think about sugar is it is all about the amount and the level. So I've looked at every sugar substitute out there, some of the more natural ones, including more traditional ones like sugar alcohols. And one thing that we have observed is that there are these ingredients like, you know, aspartame and other replacements that have been in the market a long time, that have been allowed by the FDA, that have been used in products. And it's only now, 50, 60 years later, that we're finding that it's linked to potential neurodivergence, that it is linked to potential issues with heart disease or other things that are really negative in terms of health outcomes. And so one thing that I'm really sensitive to is I don't want to use something just because it's legal, because just because it's legal isn't the bar, right? Is it actually beneficial for people? Is there a risk of harm? And what we keep seeing with some of these, frankly, chemicals is that they are being shown that after decades in the market, there are now concerns around safety. There are concerns from doctor perspectives on, is this actually beneficial for patients, even though it reduces sugar, which is actually great for, you know, helping manage your weight, helping manage appetite, all of these things. And I'm seeing that concern rise again for some of these newer substitutes as well, including monk fruit. So monk fruit is 200 to 250 times sweeter than sugar. And there's already early research showing that there is some concerns that because it is such a high level of sweetness, we're effectively training children to crave higher levels of sweetness overall in their diet, and that it can actually be addictive, which is crazy. Like, it's scary.
It's like crazy that's even possible after all the food is doctored up to be so sweet to begin with. That
yes.
There's an even higher level of damage.
I know.
You can do with something else new.
Yes, exactly. And, you know, up until very recently, it wasn't allowed in the EU. And so there's a complete lack of long-term safety studies on some of these sugar substitutes. And the way we think about it is, you know, the sugar level in our products are around the level of about 2 to 3 grapes. And so we think of it as, okay, we don't want to be using these ingredients that can be addictive, that are 200 times sweeter than sugar, that may be training children to actually want more sugar in their diet at a very sensitive period of time in their lives, right? That early diet that they receive often shapes what they want to eat for a lifetime. And so those are things that we don't think are frankly just worth the risk. And it doesn't feel like something that we can stand behind as a brand. And so what we've done instead is really think about, okay, how do we take a very safe source of sugar that's organic, natural, all of those things, and that we feel really good about from a purity standpoint. You know, we have, we work with the Clean Label Project and have a purity award in terms of how we formulate and what ingredients we use and how we test, and make sure that while we can make something that's really yummy and palatable and something that kids will hopefully ask for, so that's not a chore to give it to them, we also don't want to be adulterating it with things that we worry in 10 years and 20 years, what will happen to the research.
So when it comes to it seems like you've established all the background research and history. Is there any research to show that your vitamin supplements are actually making changes in the people who use them, like in a prospective study, rather than saying, we know it worked in all these other populations, we're going to just apply it because we think it'll apply to the kids that take our supplements?
We want to have clinically backed studies for our products in particular, and that's a part of what we're working on the roadmap as just a small company, to be honest. One of these studies can cost even upwards of $1 million to run, and we want to make sure that we're being really thoughtful and rigorous, because you can go out and get a study done for $15,000, but it's not robust. I think there's concerns around, is the data really valid if it's being done in such a way? And I think that level of discipline has always been really critical to us.
All right, I'm going to switch gears here and turn to, so as a female founder of a really wonderful, successful, growing company, what advice do you have to others who are interested in entrepreneurship, let's say?
Yeah, I think what other people think and qualifications don't matter. So before I started First Day, I didn't have any experience in anything that was really that relevant to the business. I had done some actually relevant research when I was back in university, but that was a long time ago. And I think there's something that women are a little more likely to say to themselves, as some studies have shown, which is, oh, I'm not qualified to do this. Like, I have no experience doing it. I'm not ready to do it. And the reality is, starting a company, you will probably never be qualified and never be ready. You just have to take that leap of faith sometimes and figure out what needs to happen. And so that would probably be my advice on that.
Love that.
Yeah.
All right. Well, thank you so much for joining. I've learned a lot. I certainly want to go back to the literature and study up more and learn. And I've definitely learned a lot from even just this few minutes of chatting. So thank you so much for being here.
Thank you so much, Lyndsey. It's been so fun getting to know you and the Blueberry team better, and I look forward to more conversations.
Same here. Do you want to tell everyone how they could find you and your and First Day?
Yes. So if you go to firstday.com, that's where our brand is. And of course, feel free to email me at any time as well.
Great. Thank you, everyone, for joining the Blueberry Pediatric Podcast. If you enjoyed this podcast, do not forget to subscribe and like. Thanks so much. Thank you all for tuning in to today's episode. Be sure to subscribe to the show for more episodes. And if you love the show, if you haven't already, please be sure to leave us a 5-star review.